Hello, all. My name is Gina Harris, and we are talking about anxiety disorder this week. Um, I personally suffer with anxiety disorder, so this one really hit home for me. And we've all felt anxious before a job interview or an important conversation. Your heart starts to beat faster, your palms get sweaty, and your thoughts won't stop racing. Although these sensations can be uncomfortable, they are part of what it means to be human. Anxiety in small amounts helps us stay alert, motivated, and prepared. It's the body's natural way of signaling something important that needs our attention, and that you can find that in the APA DSM-5 TR. But sometimes that internal alarm does not shut down. When worry becomes consistent, it begins to interfere with our daily lives. Anxiety shifts from being useful to being harmful. In those cases, it may develop into an anxiety disorder, a condition that's marked by excessive fear, tension that goes beyond what's appropriate for the situation. And that is discussed in Hooley 2021. Anxiety disorders are among the most common mental health conditions worldwide, affecting nearly 1 in 3 people at, at some point in their lives. And that is in the DSM-5 TR. They can take several forms, such as generalized anxiety disorder, that involves ongoing and uncontrollable worry about many areas in life. Panic disorder causes sudden waves of intense fear known as panic attacks. Specific phobias that focus on a strong fear of certain objects or situations, such as flying or heights. And social anxiety disorder. The focus on this discussion is centered on an overwhelming fear of being judged or embarrassed by others. Feeling nervous in social situations is normal, especially in new environments. However, people with social anxiety disorder, often called SAD, experience fear that is far more intense and persistent. Even routine interactions, introducing themselves, ordering food, or attending a gathering can trigger severe anxiety. Physical symptoms such as trembling, blushing, sweating, or feeling detached from one's surroundings, a symptom known as derealization, are also common. And that is in TRAN 2024. What makes social anxiety particularly difficult is that individuals usually realize that their fears were irrational. And it doesn't bring comfort. It makes things worse. People worry that others can see their anxiety, creating a vicious cycle of self-consciousness and distress. The causes of anxiety disorders are complex. Research suggests that both genetic and environmental factors play a role. A family history, experiences of trauma or neglect, and prolonged stress can increase vulnerability. Some individuals turn to alcohol and drugs to ease their anxiety, which might provide a temporary relief, but often leads to dependency and worsening symptoms over time. The encouraging truth is that anxiety disorders are highly treatable. The most effective approach is CBT, cognitive behavioral therapy, which helps identify distorted thoughts and gradually face the situations they fear. Over time, CBT retrains the brain to respond to anxiety more calmly and rationally. Medications, such as SSRIs and SNRIs, can also help by regulating the mood and reducing physical symptoms. In some cases, beta blockers are used to control physical signs such as shaking or rapid heartbeat. The goal of treatment isn't to ease anxiety altogether, but to find a balance. Some level anxiety is essential for motivation and safety. The challenge is learning and recognizing when anxiety is helping us and when it is holding us back. Healthy lifestyle choices also play a powerful role. Consistent sleep, balanced nutrition, physical activity, and supportive relationships strengthen the emotional resilience. These habits help regulate the body's stress response and promote long-term recovery. Thank you.